Hello everyone and welcome to the unit of the skin and musculoskeletal disorders. Let me start with the skin disorders. Of course, we're not going to discuss all skin disorders. We're only going to discuss acne, which is a very common skin disorder, as well as malignant melanoma, which is a very serious skin disorder. Acne vulgaris. What's acne? Acne is these pustules and cysts that occur and rupture, releasing free fatty acids that cause further skin irritation. And actually, there is an organism that contributes to the pathophysiology of this acne. It's called Propionibacterium acnes. Propionibacterium acnes. It's an anaerobic organism, and it contributes to this process of acne, which is, of course, has another element, which is a hormonal component to acne. So acne has a hormonal component, too much androgenic activity, and a bacterial component, Propionibacterium acnes. The treatment of acne is based on using something like benzoyl peroxide. Benzoyl peroxide is an over-the-counter preparation. Perhaps all of you are accustomed to this Oxy 5 and Oxy 10 preparations, and it has an antibacterial properties because, again, it's the anaerobic P. acnes. Why? Because it's an oxygen. So you give oxygen to the anaerobic bacteria, so you kill it as it liberates active oxygen. Side effects are those related, and they include bleaching effect of the skin and material. Very characteristic side effects. See, when you use benzoyl peroxide, there will be some bleached areas of the skin, and even when you use a towel after using this benzoyl peroxide, the towel might get bleached. Sometimes you can get peeling of the skin, red, warm skin. When you are allergic to benzoyl peroxide, you can get blistering or swelling of the skin, and this is when you need to stop the treatment. Benzoyl peroxide is usually combined with antibiotics, as in benzacillin, we combined it with clindamycin, as in benzamycin, we combine it with erythromycin. Another line of treatment for acne is tretinoin cream. Tretinoin is a derivative of vitamin A, and it causes some sort of a chemical peeling of the acne lesions. Tretinoin cream. Isotretinoin, Accutane, is the most powerful treatment for acne. This is a very serious drug. First of all, Accutane is the most teratogenic drug ever in the United States market. So before using isotretinoin, make sure that the female patient is not pregnant. Make sure that she's using a reliable contraceptive method, and some prefer that the patient should be using 2 contraceptive methods. Why? Because this is very teratogenic drug. Another serious side effect of Accutane, which is, by the way, given as oral medication, not as a topical preparation. Another serious side effects, hepatic toxicity and blood toxicity. Therefore, you need to follow up the liver function tests, and you need to do CBC every 4 weeks. Once a month, you should check the liver function and the blood function. Very serious drug, and it should be prescribed only by a derm specialist. So, the plan of treatment: if you have mild disease, mild pustules, mild cysts, just use topical antibiotics, clindamycin, erythromycin, and use the benzoyl peroxide. And you can use topical retinoids as well if the previous were ineffective. Moderate disease, you can use benzoyl peroxide and you combine it with retinoids, some of these are examples of the retinoids. In severe cases, here you need to use systemic antibiotics. Clindamycin, minocycline, doxycycline, minocycline, azithromycin can be also used. And you can use oral isotretinoin, Accutane. That's a strong teratogen. Don't forget, always check urine pregnancy test and make sure female patients are on reliable contraceptive method. Our case study for acne is about a 21-year-old woman with a history of facial acne since the age of 18. Now, what might be a major concern with prescribing monocycline or isotretinoin for this patient? Remember, isotretinoin is pregnancy category X. Monocycline, which is a tetracycline antibiotic, is a pregnancy category D. It means it's dangerous. The baby is not going to die, but the baby is going to have permanent brownish teeth staining of the permanent teeth. So the baby's permanent teeth, when the permanent teeth erupts, they are going to be permanently brown, and this is so disfiguring. Therefore, tetracyclines, doxycycline, monocycline are pregnancy category D, and isotretinoin is pregnancy category X, and these are your concerns with these medications. How stress can be a contributory factor to this patient's acne? And I'm sure this is the question of most of you as you're watching me now. Acne, is it related to stress? Definitely. Why? Because stress stimulates the synthesis and release of corticotropin releasing hormone by the hypothalamus. Consequently, this corticotropin releasing hormone is going to increase the production of ACTH from the pituitary, and ACTH will stimulate the adrenal glands to produce cortisol and other glucocorticoids, and will also trigger the synthesis and release of androgens, and these androgens will worsen acne. What is a likely cause of this patient's progressive acne? What's the likely cause of this patient's progressive acne? Based on the abnormal magnetic resonance imaging scan that has shown a mass in the right adrenal gland, a possible and a likely cause of this patient's acne vulgaris is an androgen secreting tumor. Androgen secreting tumor. Too much androgens, too much acne. Too much androgens, too much acne. As the tumor grows, it secretes more androgens, and acne becomes more progressive and more severe.